During the pandemic, we gave expedited authority, I believe. Did we see any ill effects of that when you were bringing people on in a matter of weeks?
So, Senator, to my knowledge, that authority was commensurate with the national public health emergency. And yes, during that time, we were bringing folks on in just a short number of days.
But we have that experiment.
We do.
That we did, and did it work or did it not work?
It definitely worked on bringing folks on. At the back end, we had to do all of the credentialing and privileging and quality checks to determine suitability. And our overseers have called out some issues with our suitability determinations in the past. And so it's always a tough balance, Senator, between getting the number of folks on board as fast as you can with getting the right quality of individuals, for example, who don't have things like state licensing board citations and tort claims, things that would surface during the normal process. And so we're happy to talk to you and your staff about ways that we might think authorities might help with onboarding times. But what I can tell you is the PACT Act authorities have helped tremendously. The fact that we can offer, for example, lump sum recruitment incentives up front, I think have encouraged more people to wait it out to be able to get that incentive, which has helped. But we should really shorten that process, and I'm dead focused on that.
Right. Well, let us help with that. I think all of us are interested in trying to, that certainly doesn't happen in the private sector, but there's reasons for that. But again, we need to fix that. You're simply not going to get the quality of people that you need when they have to sit around for 18 months, wondering if they're going to get the job or not. So most of my questions have been answered, and you've done a good job of answering. I want to reiterate how important it is looking at the backlog. We wanted to tier the presumptives. You all felt like you could go forward without. So, we're going to be watching that. I know you all are watching that. Let us know how we can help. But we've worked so hard to get things under control, and we certainly don't want that to spiral out of control. So, like I say, you all assured us that you could do that. And it looks like that you're on the way to doing that. The other thing about the getting the word out regarding the deadline and all of those kind of things, one of the concerns that we have coming from Arkansas, coming from really all the states represented here, we have very rural areas. What are we doing are we doing anything different about the rural areas, or is it we feeling like we're doing enough adequately to take care of those where sometimes information is just a little bit more difficult?
Yeah.
And so many of our veterans, that's where so many of our veterans come from.
Yeah, we're actively pursuing various means of outreach to get the word out. So in addition to all of the usual modalities, whether it's TV or radio or social media, we're working with our partners in various communities. So Senator King mentioned I was in Maine. I went up to Caribou and was out there in a community event. One of the things we've learned is don't necessarily host the outreach events in VA facilities. Go to the community where the veterans are. And we have tools and data to identify where there are underserved veterans in underserved parts of our communities. And so working with our local leaders, working with the states and with the counties, we're able to identify and get the word out. But I think the important takeaway for us is we're pushing towards this deadline. For us, it's August 9th to file a PACT claim to preserve the earliest possible effective date. Dr. Elna Ahal is pushing for the open enrollment. We can't stop at these deadlines. We've got to continue this approach of proactive outreach and trying to reach veterans where they are.
Good, very good. I'm just thinking out loud, and you all can chime in, but as somebody that's run a lot of campaigns through the years, trying to reach people for different reasons, rural radio is something, that in those areas is very effective. That's if you're not doing that, and I think they, again, that's a group too that I think would be very willing, to do the public service announcements to get the word out. They realize how important it is, but that's another tool. If you're not doing,
Yep.
that's something that you might ought to to look at folks. You know.
Yeah, Senator, I did a satellite media tour with, I think, 25 or 30 local television and radio stations to get the word out about PACT. And I think we got about 8 million impressions. My hope is that they keep replaying it and that increases. But efforts like that, and I know Dr. Eleanor Hall is doing the same, trying to reach veterans where they are is important. I'll add, in Winston-Salem, I just got briefed by our regional office director, who's got a very data-driven, forward-leaning outreach effort, working to identify where we need to go and holding his leaders accountable to doing that outreach. And so there's a good model. We have a number of good models across the country and making sure that we're identifying those best practices and exporting them elsewhere.
Thank you, guys. We do appreciate your hard work.